Hi everybody, my name is Ashley Barker and thank you for coming to my medical ASL website. I really created this website out of passion. I just want to disclaim that I am not an interpreter and I've tutored before in ASL, and this is not to be used in place of an interpreter. I really wanted to create this because one of my many reasons of becoming or wanting to become a physician is to create awareness in the medical field about deaf and hard of hearing. And this website, spreading the language of ASL, is just something is my passion, but I think could really help the medical community. There's many different websites that teach ASL, but I wanted to create one that's kind of more towards the medical field. So if you follow my tabs, you would see that it will start off with like ABCs and numbers and basic phrases that I think everyone should know in ASL. And then it starts off with medical terminology. That's where you're going to find a lot of most of my videos, because I'm going to assign medical terminology that you might see every day. And then it's going to talk about a little bit about the deaf culture, about sign language, about how you should treat a patient that's deaf or that's hard of hearing. So, and then I kind of put some more sentences together so you can see how you can sign ASL sentences, and then vocabulary, which is just vocabulary that you may see to describe a patient, to describe yourself, or just kind of vocabulary that you might need to know in real life or in the medical field or anyways. So again, this is not to take the place of interpreter. This is just to assist you into becoming a better physician or better pre-med or better medical student, so you can communicate with patients better and really help join the hearing world and the deaf and hard of hearing world to one world. So there's not that separation and that big language barrier, because this language barrier is a big problem in the world, but really especially in the medical community. There's many aspects where deaf and hard of hearing people are not getting the treatment that they needed because of this language barrier. So you really need to make sure that there's an interpreter in the patient's room or in the hospital, but this would be a great way to start and make your patient feel comfortable and heard, and that you acknowledge their culture, and also would be a great basis to at least talk to them for a little bit. So I really created this out of passion, and thank you.